That's a really good question. The main difference between public and private, apart from the long luxurious stay at the Hotel Greenslopes, is that private maternity care lets you choose your maternity care provider. In public, your costs are covered by Medicare. If you book early, you may be able to access a midwifery group practice where a small group of midwives will look after you through your pregnancy, birth and beyond. But the reality is that most people that book through the public system will end up having what is known as GP shared care. This is where you'll see your GP for most of your visits, and you'll just be seen at the hospital clinic at key points along the way. So usually your first visit's at about 20 weeks, then you might have one at 36 weeks and then around your due date. Even though we love things to be perfectly normal in pregnancy as much as you do, believe us, we love it to be perfectly normal, but sometimes complications arise. And I think that it's really handy when the person that's already looking after you can also manage any complications that come up. You will be so happy to see that familiar face come through the birth suite door, or even the operating theatre door if that's what's happening, and you will know that that person has an idea of how you'd like this day to go. In a public hospital, if a problem arises, you may meet the person who has to deal with that problem for the very first time. They are qualified to do that, but I believe that it's the familiarity, the trust you have in your obstetrician, and the bond that you've hopefully made with them that's going to make all the difference on the big day.